I'm here with Marie Shinmoto, who's the owner and physio at MAP Physiotherapy. Marie, you and I end up working together. Would you like to tell my clients a little bit about what you do?
So I've been a physiotherapist for over 30 years. I start not wanting to mention how many years. I spent my first 10 years working at CHIO, so I worked with babies and adolescents and the whole gamut of children. Sonya and I often work together with infants with breastfeeding issues. So people don't often realize, a lot of people, my older clients, my adult clients, are surprised when I say I work with infants. They're like, oh, what can you possibly do with a baby? But Sonya will often refer to me with babies with complex issues where it's not just a question of working to get a better latch, or there's more sort of issues involved. So the biggest thing that we work with is the overall symmetry of the baby. Believe it or not, some babies are not born straight. They're a little bit crooked. I affectionately call them banana babies because they're slightly curved like a banana. So there's tightness through one side of the body, and that affects breastfeeding. It also affects other issues in terms of overall development of the baby. And so that's what we work with.
I've referred a lot of babies to you over time, and knowing that you can work with all these babies that, they might like to look this way, they don't like to look that way, maybe their head's like this. And parents don't often notice these things. And that's, or like you said, they're a little bit C-shaped or banana-shaped. I wouldn't have noticed that as a parent either. To me, like that would be my beautiful, perfect baby. And they are still beautiful and they're perfect, but have some asymmetry. And I end up telling parents, this is, for an infant, like this is relatively easy time to get rid of these issues. Like, what would you say in terms of timing for starting physio?
Yeah, I mean, the sooner the better. If you notice that your baby prefers their head turned to one side and has difficulty turning the other way, then yeah, the sooner the better, because then it's quicker and it's easier to fix. And I have seen babies that are a little bit older, like around 10, 11 months, that haven't had it addressed. First of all, it's a lot harder to treat a mobile 11-month-old, right? Than a newborn that just lies there and lets you do what you need to do. But I'm now also seeing kids like 11, 12 years old who didn't have this tightness on one side of the body addressed, and now they're having issues with pain in various places. Yeah, these things do not go away on their own and need to be addressed. So yeah, the sooner the better. I see babies like a week old or 2 weeks old.
Yeah, I think I would call that a myth. And maybe you can tell me if you agree or not that, baby will outgrow this, but they don't. They just learn compensations to get around it so that when you then have the 11 and 12-year-olds, it becomes more noticeable again.
Yeah, exactly. The traditional approach to torticollis, which is when the baby has tightness on one side and prefers their head turned to one side and has difficulty getting to the other side, is just to kind of stretch it, kind of force it where it doesn't want to go. And baby doesn't like that very much. And so it's not very pleasant for parents to have to do. And it doesn't address the main issue, which is there's actually tightness through the whole side of the body, not just in the neck. The head is what we see, but it's the whole side. And so I've also seen children later on who have had, oh yeah, well, he had a torticollis when he was a baby, but it's gone now. It's like, it's actually not. There's still tightness through that side, and they turn this side and then they can't quite get the head around, so then they turn the whole body. So babies are really smart, and they figure out how to compensate. So they fool you into thinking they figured out how to turn that way, but they can't. And we think the problem's gone, but it'll rear up later.
Mm-hmm.
In some form.
Yeah, that's really interesting and unfortunate when the baby's so easy to work with and so malleable and so easy to correct the issues. Mm-hmm. It's not known that well that this can make a huge difference.
Yeah, and unfortunately, a lot of parents are told, well, they'll grow out of it. They do not. They will not grow out of it. Like you said, they just figure out how to compensate around it. And at some point, you pay for those compensations.
Mm-hmm. Yeah. I sometimes muse about what it would be like if all adults had something like that as infants, for some of the asymmetries that people get over time.
And so I'll sometimes see a family, they have a baby and they have the they have torticollis, they've got some tightness in one side. And so most often my referrals do come through lactation consultants because you're the people that pick that stuff up. And I'll treat the baby. And then sometimes they appear, 2 years later with a new baby. And they will sometimes say, oh, we just wanted you to check and make sure everything's okay. I'm like, well, that's fantastic, right?
It is a proactiveness again, eh?
Yeah, that's ideal. Like, let's have a look into, yep, okay, everything looks good, or there's a little bit of something to work on. So
yeah, in my own practice, I prefer the proactive consults too, just to sort of nip any potential problems or in the butt.
yeah,
So
exactly.
it's cool that you get those later on. Is there anything else that you wish parents knew before they came or to come?
I always tell parents, like, trust your instincts, right? As a parent, you often have an inkling something's not quite right. So even if another health professional says it's fine, they'll grow out of it, if you really think there's something that should be checked out, then you really should. And I'd really encourage you to, because like the worst thing that happens is we say, it's great, you're fine, right? So trust your instincts because parents are usually right.
Yeah. And I give that message too. Do you find that people generally need to refer? In my practice, I think most people are self-referring. And do you otherwise need a referral?
Physiotherapists don't, and haven't for like 40 years, needed a referral from a physician to see a patient. However, some benefit plans may still require that. It's always best to check first with your benefit plan to see if you do need a referral.
That's really helpful. And I so appreciate on my end how I know that you're there and that you are going to be part of that net of support for families that I see. And I just appreciate that and hear good things all the time, which is why you keep getting referrals from me. So.
Well, thank you. And I mean, I feel like these babies are well supported when you're involved as well, lactation consultant together with physio, and I find that you get results faster doing that, right?
Absolutely. So thank you for your time with your babies and your time with me today.
Thank you.